So it's kind of like social media, it's, you know, like you're battling social media. Does that help?
It does.
Yeah. And we can talk more about that.
Other questions? Yes?
I'm wondering about guidelines or insight when someone is working with someone with chronically ill or a mentally impaired person, that you're trying to put together a budget in which that person has minimal ability, and you have, what
Right.
kind of guidelines do you have as a way of dealing with the emotional health, but at the same time, that you're not taking away the integrity or the personality of the other person who may not have the skills? I mean, this is not a science based apart. What guidelines do you have at that point?
That's a tough one. I can speak personally on that. You know, my father-in-law was diagnosed with Alzheimer's earlier this year. And that's one of the meetings I have on Monday is with my mother-in-law to start helping her to take over the finances. That becomes very much of a personal, individualized approach. And, you know, in this scenario, you have one person who took care of all the investments, you have another person that took care of the checkbook. Sometimes that's the same person, and that's the person that now is diagnosed with something. So then, and quite often that was the male, but not always, it depends on the generation. That's changed a lot. But if you look at, you know, the generation of, I'd say 70 and over, that's still predominantly the male that was in charge of those things. So then you have a widow or someone who has a loved one that now is gonna become incapacitated at some point in time, and you need to allow them to still have a level of input. So it's delicate, it really is. So it's a lot of hand-holding. It's setting up systems in place so that they still feel like they have a role, but they don't really have control anymore. They just think they do. You know, they could still balance a checkbook, but the other person double checks it. You know, there could be two checkbooks. So that way they still have a role. You know, there's different ways that you potentially could do that. But and that's an evolution that happens over time. So there's a lot of communication that has to happen. They're involved in the meetings, you ask their input, and that may or may not be used. They don't need to know. But their input is still there. They still feel valued. Now with my father-in-law, he's pretty lax with it. You know, others are more aggressive. So you have to really look at it personal. But, you know, a lot of times you're gonna get lawyers involved and other people involved to protect the finances. But when you deal with that interpersonal, it really is personal. So there isn't one single guideline. It's something that will have to continue to be communicated. That's one thing we're gonna be talking about on Monday is how often, how frequent, and, you know, set up kind of that red phone, that, you know, the Batman phone, they can call anytime and get that advice when things change, because it can change in a hurry. I know it's kind of a vague answer to that, but it's a tough one to answer concretely.
Other questions? Yes?
Rebecca,
Mhm.
you seem to deal with people that are already out of money before they even get to being diagnosed with something. How do these people get along if they didn't have money in the first place? Now they have bills, but they're already retired, and how do things get paid, or do they not get paid, or does the government pay them, or how
Well,
does?
there was that study showing that more than 40. I'm sorry.
That's the question.
Yeah, repeat the question so that you got the mic. Go ahead and repeat it.
He's asking what an individual, I guess.
With nothing and just retirement, and
Yeah, how do you
Can't get
expect
by.
to go? How do you expect to pay for bills if you're already in debt, kind of thing, or is that kind of where I'm going with
Yeah.
that? So I guess that my opinion on that was mostly I don't think people do. I think that's why more than 40% of our bankruptcies in the U.S. are medical bankruptcies, like 40% of them. And so I mean, unfortunately, it's just a hole. It's just a very big hole, and I honestly don't know how medical bills work as far as when you become deceased, like how that falls into a spouse's. Do you know that? No. Does it become their debt when? See, and I don't even know, because that could even be a further discussion where, yeah, you have a spouse where their perhaps husband may have died early on, or, you know, by cancer, and do they acquire those medical bills and following?
Well, what if, I mean, like, what if the people are living longer? What if they live past what they figured they were going to live, and now they have no money other than Social Security coming in, and then, but Social Security doesn't cover everything, the medical doesn't cover everything. So all they need is one bad bill, and then they can't get by. What do they do?
I think they go bankrupt, unfortunately. It's not,
But you just claim bankruptcy and they put you in jail at 85?
no.
You know?
I mean, unfortunately, medical bills continue just to accumulate. I mean, it's not, but it doesn't go against your credit scores in some sense.
Well, I mean, but the hospitals can't deny you to go there if you're.
No,
Yeah, they
for
should.
emergency
You know.
situations they can.
Yeah,
Um,
but you wouldn't be able to buy
you
pills.
have people that do go into debt for, you know, medical bills. That's very common. And that can continue to grow, and the debt continues to grow, and they might mortgage a house or have a lot of credit card debt, and that's common, and they're paying on it until the time they die.
People take
And
out
that's-
mortgages for.
Yeah, they
Yeah.
do, reverse mortgages, whatever it is, there's been a variety of different ways that people do that, but they continue to pay on it. There's bills, and the hospitals will usually work with you on, you know, that debt, and there continues to be debt service over time, whether it leads to bankruptcy or not. I'm not a bankruptcy lawyer, so I couldn't tell you how all that's gonna work, and I have to be careful on making any type of comments on that kind of stuff. But the other part to that, which, I don't know how, I've been surprised by this every single year, you know, we have, Affordable Care Act's been around for quite a while now, you know, and obviously Medicare's been around for decades. It's amazing to me how much people don't know how these things actually work. Just in this past health insurance season and Medicare season, I can't tell you how many people I talk to that have been on Medicare for years, or have been avoiding health insurance for years, and when you go through it and say, this is actually how it works, you're like, oh, it's not as bad as I thought. And, you know, one specific individual, his wife recently passed, and she and him had health insurance. It was a Blue Cross plan. It was through Blue Cross Direct. Well, with their income, they were missing out on almost $1,000 a month of subsidies. They never applied through the marketplace. They just went to Blue Cross Direct because they never asked the question. There's information out there, but shocking to everyone, the government sucks at communicating. I know, that's a shocker. And if you go on their website or get their pamphlets or whatever, it's horrible to try to read it. Well, I'm one of those weirdos that goes on irs.gov and reads things. And, because I want to know how things work. I want to know why they work the way they work. I want to know what the rule is and how we can work through that. And, you know, the government is horrible at that stuff. So what people do when they don't know is they don't ask anybody and they don't do anything. So people are on Medicare and didn't sign up for the right stuff yet, so now they have penalties. They never knew the penalties would apply, so you try to get them on what they should get on, and now they have to pay penalties the rest of their life. And there's a lot of that stuff out there, but they were never communicated when they turned 65 of what they actually should do, what they should look at. And it's amazing, some of the programs that we have, really good programs out there. Does it work for everyone? No, it doesn't. There's always going to be people that fall through cracks somewhere, and nothing is perfect. But we actually have some good programs out there. People just don't have enough information about them. And they don't ask the right questions, and they can prevent some of those debts, or at least minimize that dramatically.
Other questions? Yes,
Don't know whether this is a question to address to you, but to government society in general. I have great insurance coverage as a retired teacher. And now I have, the priority Medicare, whatever. when you go into, I had a doctor's appointment with a new doctor, and you have to fill out all the paperwork, and I was amazed, offended, disgusted by the questions, like, you know, if you do not have insurance, do you understand that you will have to pay the doctor up, that you will have to pay upfront before you see the doctor, blah, blah. And I just thought, this is so dehumanizing, it's just, how do they
Mm-hmm.
how do they get away with this level of dehumanization of patients?
Mhm.
Are we in a situation where we just sit back and take it, or, you know, how do we improve this situation? What do we do?
I think it's because we're in a disease management system and it's not a healthcare system. That's why. It's not, it has nothing to do with healthcare. It's about, oh, you're sick already, so this is emergency medicine. And that's where it's backwards. We're investing a lot of money towards things that have already happened when preventative healthcare should became a priority a long time ago. I mean, that's my perspective on it, especially in this type of healthcare. It's just, for the most part, people are already sick, and those bills have already accumulated. And so it's unfortunate that people are, you know, there is that diversity, and there's such a large barrier between people that have money and don't. I mean, I have one more stat that I felt like I really wanted to, I mean, there's a daily of, let me see real quick. Give me a second. So the average daily hospital cost is $5,220. And the average annual nursing home rate is $97,450. I mean, that's crazy. That's healthcare costs. It's like, are prepared for this? Because I did not know those numbers. I mean, even in looking at, so it puts perspective on, like, there's a huge emotional factors of these types of expenses, and really what are they providing us? So, yeah, unfortunately, I think it's just disease management.
Yeah,
My awareness is that there's a formula by which people are charged for medical care. When I look at the medical bills and and talk to other people, if you have a medical bill that's, let's say, $30,000, there is a formula where your insurance is involved, you're involved with deductibles, how much you pay. But if you didn't have any insurance and you were a person of wealth and means, you can go and negotiate that. And you usually negotiate it that the service providers get 40% of what the bill is, what you see. So in other words, there's a $30,000 bill there. If you figure that 60% of that is fluff that they negotiate, if they can get it all. But the point is, the system is fixed where they are assured that they get the 40%. That's my awareness of how the system works. And you may disagree with that, but I know some people who've done that, who could not, their sons or daughters did not have the expenses to pay for it, but went in and negotiated to get it done with that percentage. And I've looked at my own insurance bills, and I figured that out even yesterday, and it came to 39.7%. Am I making any sense to you?
Yeah, no,